Today I'm talking with Dr. Rahul Basole, Associate Professor in the School of Interactive Computing here at Georgia Tech, and a colleague of mine. He and I actually work together on the research we're going to be describing. Rahul, you're also the director of the Tenenbaum Institute here at Georgia Tech. Can you tell us about that?
Sure. The Tenenbaum Institute is a multidisciplinary research institute at Georgia Tech that draws on all colleges here at the university. And we're fundamentally interested in how large, complex enterprises change. And we use a systems engineering approach to study that.
And we were really brought together when you decided to use that approach to model the Center for Health Discovery and Well-Being, a joint Emory-Georgia Tech project that helps people who have risks of developing chronic disease later in life change their lifestyles and behavior in order to mitigate those risks. We actually developed a business strategy using this model that would fit the needs of all the stakeholders. And doing this required modeling all these interests. Can you describe how that was done?
Certainly. So this particular model involved a four-level approach, which consists of people, processes, organizations, and the ecosystem. And there are interactions that occur within and across these levels. Each of these levels really represents a stakeholder as well. So at the people level, we would look at providers and patients. At the process level, we look at how these healthcare processes are actually delivered, which are often delivered by one or more organizations, the third level in the model. And ultimately, there are ecosystemic forces that impact all of these different levels.
Now, the students are familiar with the various approaches to modeling and simulation. So can you tell us which approach was used at each level?
Definitely. So we did use a multi-simulation paradigm to approach this particular enterprise. So at the people level, we used an agent-based modeling approach. Processes tend to be modeled as discrete event simulation, but we also found that later on that agent-based simulation was actually quite appropriate. The other two layers were done both with systems dynamics, but also agent-based modeling approaches.
So a mixture of different approaches.
Absolutely.
In one model.
That's correct.
So I know, because I was involved, how difficult and time-consuming it was to get the process layer defined. Have you found that to be the case in other healthcare projects? And what do you think is different about healthcare that makes its processes so difficult to pin down?
Sure. It's quite remarkable how complex healthcare is. So we found that process modeling in itself in healthcare is quite challenging as compared to other domains where it's actually very well defined. Manufacturing is probably the best example where you have well-defined processes and you know how widgets flow through the system. In healthcare, you have an enormous amount of stakeholders that come together. You have teams and collaborations. You have patients moving through the system. And all of that is sort of distributed both geographically and also temporally. And that makes process modeling quite challenging in healthcare.
Collecting the discrete data about events is also a challenge as opposed to manufacturing. Can you talk about that a minute?
Certainly. So I think that with an increasing amount of digital data now in healthcare as well, it's still quite challenging to really clearly lay out how processes happen. So we can leverage lots of different data sources for that, administrative data, clinical data, but even that can be very noisy, can be very messy. Sometimes there's missing data as well. And then actually identifying sequences of events in healthcare data is actually very, very difficult.
So we're now exploring a more automated approach to that called process mining. Can you explain how that works?
Sure. Process mining really has its roots in the European academic disciplines. And what they have done is they've used data mining approaches and visualization to infer processes from digital data. And it involves lots of sophisticated analytical tools. And the idea is that could we use digital data to sequence together how events map out?
So we've done some preliminary work on that in the treatment of pediatric asthma in the emergency department. Can you tell us how that worked out?
Sure. So we used digital data for roughly 6,000 pediatric asthma patients. And the idea was to obviously identify variations in care by patient strata, but also by providers. And the idea was to identify variations in cost, quality, and outcomes. we have developed a tool, a visual analytic tool that could actually map different processes and allows you to filter by different criteria across patient strata, providers, patient demographic data. And this visual analytic tool can be used by clinicians to explore how processes are delivered, where there might be actual differences in care, and potentially how to improve them.
So I'm sure the students at this point, near the end of the course, can appreciate just how challenging what Rahul just described is to do in practice, given all of the problems we've discussed throughout the course in terms of the interoperability of the systems from which the data needs to be collected, the differences in the way the data is represented, the data quality, as we mentioned a few minutes ago. A really exciting area, and you should stay tuned, see what we end up doing in a few years. Thank you.
Thank you.